What is the mortality rate for children infected with measles? A. 1 in 20. B. 1 in 2000. C. 1 in 50. D. 1 in 10,000. E. 1 in 500. The answer is E. 1 in 500. Measles, while generally only a moderately severe disease, is fatal in 1 out of every 500 children who contract the virus. Genital herpes is caused by what virus? A. Herpes simplex virus type 1. B. Herpes simplex virus type 2. C. Herpes simplex virus type 1 and 2. D. Human herpes virus 7. The answer is C. Herpes simplex virus type 1 and 2. Genital herpes is most frequently associated with herpes simplex virus 2, HSV2, while herpes simplex virus 1, HSV1, has been associated more often with oral herpes, cold sores. However, new evidence suggests that both viruses can live in either location. HSV1 can spread to the genitals and cause genital herpes, while HSV2 can be spread to the oral mucosa to cause cold sores. Adult complications from cytomegalovirus, CMV, are most common in what population? A. Teens. B. The elderly. C. Athletes. D. Immunocompromised individuals. The answer is D. Immunocompromised individuals. In adult populations, cytomegalovirus poses the greatest risk to immunocompromised individuals, such as people on immunosuppressive drugs or in HIV patients who have developed AIDS. In pregnant people, CMV generally does not pose a risk to the mother, but rather to the fetus. Athletes and teens that are not immunocompromised often will have mild or unnoticeable symptoms when infected with CMV. Cytomegalovirus, CMV, belongs to the family Herpesviridae and causes cytomegalovirus mononucleosis, cytomegalic inclusion disease, and cytomegalovirus infection in the immunocompromised. CMV resembles infectious mononucleosis in that atypical lymphocytosis, fever, and malaise are characteristic symptoms to both. Pharyngitis is present as a symptom, though less severe in CMV than in infectious mononucleosis. The heterophile antibody test is also negative in CMV. Toxoplasmosis may also mimic CMV and infectious mononucleosis and thus must be considered in the differential diagnosis in those patients with a negative heterophile antibody test and mono-like symptoms. Transmission of CMV from mother to fetus may occur at any time during the pregnancy. Fetal loss is less likely than congenital CMV infection, which, in its most severe form, is manifested as hepatosplenomegaly, microcephaly, chorioretinitis, hearing loss, and thrombocytopenia. The mortality rate is high. CMV is common. Most common virus transmitted from a pregnant woman to her unborn child. 1 in 150 children are born with congenital CMV. 1 in 3 pregnant women who get CMV will pass the virus to their unborn child. CMV is more common than 29 combined metabolic and endocrine disorders in the recommended U.S. newborn screening panel. Second children are more likely to be born with CMV. Because mothers are more likely to be exposed to CMV picked up by their own children in daycare or playgroups, women are more likely to contract CMV the second time they get pregnant, a bad thing considering the virus can do the most damage to a fetus when a woman is infected for the first time during her pregnancy. What type of virus is molluscum contagiosum? A. Retrovirus. B. Adenovirus. C. Poxvirus. D. Herpes virus. The answer is C. Poxvirus. Molluscum contagiosum is a form of poxvirus. Poxviruses are a family of enveloped group 1 double-stranded DNA viruses that includes Molluscum contagiosum virus, smallpox virus, vaccinia virus, and monkeypox. Which of the following class of viruses is responsible for all warts, including plantar warts, genital warts, flat warts, and common warts? A. Epstein-Barr virus. B. Herpes simplex. C. Cytomegalovirus. D. Human papillomavirus. The answer is D. Human papillomavirus. All forms of warts are caused by the virus HPV, or human papillomavirus. In addition, HPV is the cause of a variety of dysplasias, including cervical dysplasia, vulvar dysplasia, and oropharyngeal cancer. None of the other viruses listed are associated with warts of any kind. Over 70% of cervical cancers are associated with which two strains of human papillomavirus, HPV? A. 6 and 11. B. 16 and 18. C. 31 and 33. D. 2 and 7. The answer is B. 16 and 18. While HPV strains 31 and 33 have been associated with genital malignancies, more than 70% of cervical dysplasia is associated with HPV strains 16 and 18. Strains 6 and 11 are associated with genital warts, while 2 and 7 are associated with common warts. 90% of cases of Condylomata acuminata, genital warts, are caused by what two strains of human papillomavirus, HPV? A. 6 and 11. B. 51 and 52. C. 42 and 43. D. 30 and 54. The answer is A. 6 and 11. While all of the strains of HPV may cause Condylomata acuminata, 90% of all cases of genital warts are caused by just two strains, 6 and 11. All of the following are forms of herpes virus except A. Varicella zoster. B. Herpes simplex. C. Epstein-Barr virus. D. Rotavirus. The answer is D. Rotavirus. There are more than 130 types of herpes viruses. Of those, 8 are known to infect humans. Some of the more common examples are herpes simplex 1 and 2, varicella, zoster, Epstein-Barr virus, and cytomegalovirus. Less common viruses include human herpes virus 6, human herpes virus 7, and Kaposi's sarcoma-associated herpes virus. Rotavirus is not a herpes virus, rather, it is a double-stranded RNA virus in the Reoviridae family. Human papillomavirus, HPV, is associated with increased risk of which of the following cancers? A. Oropharyngeal cancer. B. Anal cancer. C. Vulvar cancer. D. All of these are correct. The answer is D. All of these are correct. Human papillomavirus has been associated with several forms of cancer, including cancers of the cervix, vulva, anus, and oropharynx. It is also associated with penile and vaginal dysplasias. Which of the following is the microbe most frequently associated with the common cold? A. Influenza. B. Human coronavirus. C. Rhinovirus. D. Adenovirus. The answer is C. Rhinovirus. Rhinovirus, a type of P. coronavirus, is implicated in up to 50 to 80% of cases of the common cold. Other less common causes include human coronavirus, 15% of cases, influenza, 10%, and adenovirus, 5%.